right, Miss Mary, so if you would, tell us a little bit about what brought you to my office, how bad you were hurting, what you had tried, and what you had been through up to that point.
Alrighty, well, I came to your office because I was having severe neck pain and shoulder pain that was making me lose mobility on my left arm. The pain was severe. It was excruciating pain. I have a friend in California who is a patient of a very popular Gonstead Chiropractor over there, and she recommended. She said, "Don't keep going to your normal chiropractor, Mary. You have to try a Gonstead Chiropractor." She helped me. One night when I was in a lot of pain, I called her and I said, "Well, please help me. Let's find somebody." She said, "Well, hopefully we will be able to find someone in Texas because there are not many."
There's not many Gonstead people for sure.
Yeah, so I'm one of the lucky ones because you're very close to my house. So the following morning I made the phone call. Stacy was wonderful. She was able to talk to you to give me an appointment. Same day, she called me 10 minutes later and she said, "He will see you right now. If you are in a lot of pain, go ahead and come in. He will see you." So I came, and after a couple of adjustments, a couple of sessions, my pain went from a 10 to, oh my God, a 4. And normally with some other chiropractors that I was seeing, it would help for a little bit after so many adjustments, but some other areas were getting bad. I mean, it was getting better in some areas, but then other areas were getting out of adjustment, I'm guessing. Right now I'm able to exercise. I'm lifting weights again, and I feel a lot better.
Yeah, and it's been a little while since we've seen you because of all this COVID stuff going on. It's thrown a wrench in a lot of people's plans. But you've held up really good since the last time I've seen you.
Thank you.
And you've been seeing other chiropractors for this, right?
Yes,
and how long did you try that before you came here? Before your friend told you about the Gonstead?
Before the flare up with my neck and my shoulder.
Right.
3 years.
Wow, 3 years.
3 years with multiple adjustments, 3 and 4 times a week, adjusting, and sometimes I was getting better on that specific area, but I was getting worse in some other areas.
Wow.
At one point I lost all my shoulder mobility, my upper thoracic spine mobility was not the same as, I know my body. I used to lift weights and stuff, and after some things that happened with my health, I got overweight and stuff, and I noticed that they were not doing what I needed for my specific case.
Do you feel like they kind of just really didn't check you much and kind of just did the same things over and over again?
Exactly.
Yeah.
It's like they do the same thing for everybody instead of really customizing the treatment for you. And that's what my friend told me. She said, "You need to go to a Gonstead chiropractor. He is going to adjust just the areas that you need."
Praise God, your friend knew about Gonstead. That's the problem that we run into a lot, is that when people really don't know the difference between types of chiropractors, and so when they go to most offices, they don't get checked. They're just they get what we call a random southern area manipulation, which they'll twist the neck both ways, they'll push you 3 times in the back, and they'll hit both hips, and without really knowing what they should be adjusting, they just move bones and hoping that they get somebody better. But when somebody's got severe problems, that's just not going to be good enough. So in the Gonstead work, we do that exam that you just saw me do, and we take a set of x-rays. And with Mary, it's very important that you have these films, because you can just look at her. This is her from the back, and this should be perfectly straight, and obviously it's not. So just without even checking, there's something going on with the spine that's causing these distortions. And in Mary's case, it was very clear after doing the exam, and it's the same things that I found today, that she had a lot of pressure here at the base of her neck, here where the spine deviates from straight, and then down in her low back. Because she had that shoulder pain, she also had low back pain with some other little things thrown in there. And she responded amazingly. Not everybody responds after just a couple adjustments, but it's possible if you're on the right segments and getting a good correction. So she had an amazing recovery, and I found the same things today that we had found early on. It's been several weeks since she's been adjusted, so we're going to go ahead and adjust her today. So let's go. All right, Mr. Mary, I'm going to get you over here. come over to this side. So sit first for me.
Okay.
Lay on your side, legs up on the table. Okay. Good. Keep your bottom leg straight.
Closer to the edge.
A little bit, please. I won't let you go. Okay. Just bend this leg and straighten that one. Bend this up a little bit. Arm back. Yeah, good. We're going to adjust the fifth lumbar here. Let me have this arm. There we go. Just relax. We're going to roll you over here. Just a little bit there. Beautiful. All right. Now just push yourself up. Good. Now we'll walk over to this table. Get that sixth thoracic on here. So stand on the platform there. Face stand. Hands go forward. If it's too hard to breathe, you can pull the hands down.
A lot better than the first time.
Yeah, no kidding. Yeah. Okay.
I can breathe, I can move.
Right. Yeah. Yeah, when you see areas like that on the spine that are deviated so much, you know that's a pretty significant injury at some point in her life. That's why we see a lot of babies and kids, because the problems start then. Let's relax your shoulders and breathe normal. Perfect.
Oh, that's so good, thank you.
Awesome. All right, we're coming up. We'll do the neck in the chair. Doing good so far. Here. So chin down a little bit. Just let it all come up. Okay. I'm gonna try that one more time. Put your hands back in your lap.
Here?
There you go.
Ooh.
Good one. That was stuck that time. I had to give it a little extra on that second one. Good. All right. Well, that's Mary's story. We sure appreciate her sharing it with y'all. So y'all have a good one. We'll see you on the next video.